Hi, and welcome back. Medicine is moving in the direction of reestablishing our clients' overall health by eliminating long-term obstacles. Nowhere is this more important than the mouth, a place where the outside world directly interfaces with the inside world of the body, a place with almost intimate connection to the brain, and a place that can indeed impact how well signals from the brain can reach the rest of the body, as you'll see in the airway development video. Today, we're going to look at some of the more obscure root causes of some of our clients' obstacles to regaining the robust health they want. For a dentist delving into practicing dentistry with the whole body in mind, understanding the role cavitations and dead teeth, soft tissue surgical scars, and root canals play is essential. I'm struck that no matter to whom I'm speaking, if the conversation turns to dentistry, as it often does, members of the general public are increasingly aware of the concerns I cover in this course, and more of them are preparing themselves to move forward to address these, if only they knew the right dentist to visit. That would be you. Unfortunately, the more obstacles harbored in the jawbone and oral soft tissues, and the crazier their pathogenic makeup, the more they block natural bioenergetic pathways and subject the immune system to varying amounts of chronic stress. These stress the biological terrain, which guides all health and illness, and triggers health issues long before any chronic disease can be formally diagnosed or the culprits identified, if they ever are. It's been my experience while working in what seems to be termed these days biological dental offices that physicians frequently access us with a slew of questions that demand answers. Often, they seek to have their mercury-laden fillings removed in a safe way because they understand the filling material sabotages health. They question us also about the wisdom of root canals and wonder whether they personally may have ischemic osteonecrosis in areas where teeth were extracted, particularly third molar areas. You know that the slang term for this is cavitations. This is a situation dentistry is slow to recognize, so let's talk about it. The American Academy of Orthopedic Surgeons discuss ischemic osteonecrosis thoroughly in their 1997 textbook titled Osteonecrosis: Etiology, Diagnosis, and Treatment. Though dentists seem to ignore these issues, perhaps it's partly because of the role root canals and extractions play in this serious systemic threat to health. Most of the time, the causes are attributed to the practice of root canals and poorly extracted teeth, wherein the ligament surrounding the teeth wasn't thoroughly removed. Perhaps it's also because the overall rate of ischemic osteonecrosis in molar extraction sites averages 77%, with a whopping 88% occurring where wisdom teeth were removed.
Let's go into a little bit more detail and start with cavitations because I don't believe most of us were even taught about them in dental school, even though G.V. Black described them in 1915. I remember about 18 years ago, I saw an x-ray that looked something like this. I took it to my employer and asked him what it indicated. A tooth that had been there years before was still clearly delineated and also had a kind of horizontal laddering across the socket. He just shrugged and said he didn't know. I didn't like the answer or the cavalier attitude, but of course that was still the end of it. It was many years before I realized it was a cavitation, though they're not always so cut and dried in x-rays. This one derived from a failed root canal that was extracted. The bad news was that an implant was placed directly into that gushy bone. I doubt it was any more successful. Before I move on, I want to point out that they are best detected by computer tomography, though thermography is a strong adjunct. I suspect that over time, more and more people will use this tool to pinpoint hot areas. After all, more and more women want to avoid the radiation of mammograms and are using this technology. There is no definitive way to judge how infected a root canal-treated tooth or cavitation is, but a thermogram can give some guidance. A thermography image displays infrared heat emissions, with each color gradation indicating different heat emissions. High heat emissions suggest inflammation and usually indicate root canal toxicity or a cavitation, even in an asymptomatic person. This is a small portion of a report from Alpha Diagnostics, which is now approved for use in the United States, unlike in 2012 when I posted the full report. AlphaSite 9000 offers a more comprehensive and precise thermograph than the more widely known digital imaging camera thermography with which most people are aware.
So, what are cavitations exactly? Well, they occur when blood supply to a healing extraction site is compromised. For various reasons, the area heals over the empty socket instead of generating bone properly from the bottom up. Anaerobic microbes are trapped within the site. Over time, microbes and their endotoxins migrate to surrounding bone and then on into the blood supply. It can tax the immune system for life or until a person decides to have a dental revision to clean up their mouths, which usually happens when they get a serious health diagnosis like cancer or multiple sclerosis or something like that. We need to be cognizant about our patient's overall health status at the particular time we decide that it's a good idea for them to move forward with removing wisdom teeth, because there are many systemic disturbances that contribute to ischemic osteonecrosis, as I've listed in the article included in this course called Cavitations, What You Should Know. That being said, cavitations are thought to be a particular risk in sites where extracted teeth had prior root canal treatment, were severely compromised at the time of the extraction, or when the ligament surrounding the root was incompletely removed during a crude extraction. When this happens, I suppose they form because we weren't really taught about them during our formal training, so we didn't realize how important careful extraction procedures and postoperative care was. But if you think about it, it is especially critical after the extraction of a root canal-treated tooth, as you might imagine. These are always cesspools of infection. Nonetheless, 45 to 95% of cavitations start after third molar extractions. These hollowed out areas in the jaw aren't visually detectable, and normal x-rays don't catch them very well either. Some describe the bone in them as a multicystic mush, and that's a much nicer description than many I've heard. Doctors who remediate these areas often describe it as a tarry, thick, black, oily-looking goop. Technically, it's ischemic osteonecrosis when there is no pain present, and a NICO, or neuralgia-inducing cavitational osteonecrosis, when there is pain. NICO is a progressive impairment which produces small blockages in the capillaries of the jaw. If you or your patients experienced a dry socket after a third molar extraction, it's just about a dead certainty that a cavitation is present, though the opposite isn't always true. All 4 of my extraction sites formed cavitations, which I only remediated in the last couple of years. I had 2 dry sockets. They were never painful after the initial few weeks, and there were no symptoms. I did it simply because I wanted to be sure my immune system was as strong as possible before I started a mercury detoxification program. A major culprit adding to cavitation susceptibility is the epinephrine in anesthetics. You know epinephrine serves as a vasoconstrictor to enhance working time. However, when constriction occurs, capillaries close completely. They're supposed to deliver oxygen through the red blood cells to every single cell, but those cells simply wait too long. Bone pathologists say that bone cells can't live more than about 34 seconds before they die. So, in short order, you have a lot of dead bone cells. Bone will only heal where the bone is alive. The suggestion is to use something like Setonist plane when doing extractions. I think part of the problem is that we really care about our clients. All of us were trained to be tooth-centric. Generally, we're still very reluctant to remove dead teeth. And then, of course, our patients are fearful and devastated when they're told that they have a dead tooth. And so we've traditionally offered them root canals. It makes everyone feel better. However, this unfortunate perfect storm of root canal-treated teeth and third molar extractions has created a situation in which millions of people in our culture have hidden, yet severe dental infections that have the potential to wreak havoc on health. In light of the fact that when I last checked there are at least 53 types of oral spirochetes that have been identified, this only makes sense. Let's digress again about spirochetes. Their corkscrew-shaped active forms easily drill into cell walls of dense tissues like bone that other organisms can't enter. They arrive and infect through the circulatory system. Their active forms regularly release neurotoxins. The brain and blood of Alzheimer's patients, for instance, often contain a too common spirochete of oral origin called Treponema denticola, which is what this particular sample slide is. The outer membrane of Treponema strains contribute to their ability to penetrate blood vessel walls and cause virulence. Not surprisingly, Treponema organisms are particularly good at asexual gene swapping. As we've talked about, active spirochetes go dormant when threatened, such as when antibiotics are introduced or the immune system is extremely strong. However, when conditions become more favorable for them, they convert back to their active drill bit form. So, for instance, when spirochetes are cultured in a lab, carefully matched antibiotics create a kill zone in their immediate vicinity, but off to the edge of the medium, dormant cystic forms proliferate. Antibiotics actually encourage spirochete dominance. Cavitations, just like root canal toxicity and mercury-based fillings, just can't be belief systems anymore. I have really sensed the changes over the last decade in people's thinking. After all, it's why you're here, and I applaud you for that. I expect you've already heard of polymerase chain reaction tests by now, though you might not be quite using them. They were developed by an American biochemist in 1983, so they're not new to the medical community, and they're finally making impressive inroads into the field of dentistry. For the first time, dental professionals have the opportunity to use science down to the DNA level to significantly improve the quality of care we provide for our patients. The overall impact can be profound. It helps us and your patients own what's going on in their bodies. Salivary DNA PCR testing results can provide you with a comprehensive view, for instance, of your patient's periodontal status and the particular microbes behind each case. Information such as the exact type and concentration of pathogenic periodontal microbes affecting each case can be summarized in one particular lab, along with specific recommendations for successful treatment planning. Another lab offers a great deal more information. I've included a double DNA PCR sample report in PDF format for this section I think that you'll find interesting from this particular lab. One sample was taken from an extraction site where a root canal treated tooth was extracted, and the other from a cavitation remediation site. They include antibiotic suggestions, as I suppose they must to comply with standard of care protocols, but I caution you that they do list spirochetes, and you already know that that's very germ theory based, so it's not a great option, at least by itself. It's one of the reasons I appreciate ozone and energy therapies, nutrition, and so on. Obviously, the solutions part of the report misses the environmental factors that led to the overgrowth or imbalance of microbes in the first place. We must remember the host. As you can see, this part shows what was found in a site where the root canal treated tooth was extracted. This test identifies bacteria, viruses, and fungi in removed teeth, blood tissue, implants, bone grafts, or any other oral tissue you care to send in. It tests for 90 different oral pathogens, including tetanus, botulism, diphtheria, Candida albicans, human papillomavirus 16 and 18, and many more. The specificity of PCR testing is 1 in a trillion or greater. This report goes on for about another 11 pages that I do think you'll find interesting.
Let's look for a minute at another patient's PCR test results from a cavitation site in her lower anteriors. Her levels of the spirochete Treponema denticola is concerning, but I also wouldn't be happy about the number of entamoeba parasites she hosts, not to mention E. coli. And how about that HPV-16 virus? This is worthwhile information many patients want to have, and it's great to offer them the option. These are a few basic suggestions for extractions. You'll find there are a wide and fascinating variety of suggestions biological dentists use as you start networking with them. This happens all too often. As Jerry Bouquet says, We hold the future of the human race in our dental hands. Leaving the periodontal ligament more or less intact during an extraction is like leaving a placenta during delivery. You've got to clean out the sac, like afterbirth. Dr. Hal Huggins noticed that in surgical intervention of over 1,000 extraction sites, 99% show partially or totally unhealed bone. In primal dentistry, I talk about how one of my daughters wanted to go the traditional route of ice, antibiotics, and so on after her wisdom teeth were extracted, while the other daughter wanted to avoid antibiotics, pain pills, ice, and all those traditional suggestions. We simply used a laser post-operatively, and she healed so much faster and with much less discomfort. Because we used a careful surgeon who was willing to do as I asked, neither developed cavitations afterwards. Have you ever had an ingrown hair?
I've had an about face on sequestered teeth. See what you think. Thinking about embryology and the embryonic germ layers, the marrow and the roots of a tooth are mesodermal in nature, while tooth enamel derives from ectoderm. If a person has a parked third molar, they have ectodermal tissue in a mesodermal space. The immune system will send white blood cells to attack it. If it can't dissolve it, and of course it won't be able to, then fluid will suffuse the area. It can get red, hot, and sometimes painful, but of course not always. If tissue is in the wrong space, the immune system has to expend a lot of time, energy, and precious white blood cells to try to get rid of whatever doesn't belong there, often in the face of poor nutrition. It can be another of those constant immune system challenges of which I'm speaking that mount up over a lifetime. Whatever sub-programs on which a person's immune system has to expend time and energy is diverted from working on other things like detecting cancer cells, detoxifying all those crazy environmental toxins we expose ourselves to like cosmetics, pesticides, processed foods, or even fighting gum disease in root canal treated teeth, or autoimmune issues. Yep. Sometimes people don't wait for cancers and other serious symptoms to come in for complete dental revisions. Sometimes it's just plain old fatigue or even prevention. Even the best car can only take you so far, so fast. Every car and every human has its limits. The concerns about which I'm speaking today are biocumulative. The last thing people want to do is waste immune system energy on things they can address. Health-savvy people are looking for ways to limit these things so that they can deal with the really important things that come down the pike before they get sick. Cancers don't just happen. They happen when apoptosis gets messed up. These people want to give their immune system a break. They fled biological dental offices. They will sacrifice teeth for the host, and this is not what we learned in dental school. That being said, let's launch into root canals. I know you know they're controversial. Years ago, one of the earliest online whole-body health advocates, Dr. Mercola, asked me to write an article about the pros and cons of various replacement options after a tooth died. Now, that wasn't an article I particularly wanted to write because it was such a controversial procedure then, and it still is, as are the replacement options. I had other critical things I wanted to move forward, and I just didn't want to get mired in that particular subject. Honestly, once a tooth starts decaying, perfect repair options with no downsides simply don't exist. You know that. Some are going to be better than others, but there's always going to be a cost, and it's the patient who has to decide what his or her priorities are with your guidance. I admit that's pretty hard to do. I know sometimes a patient is offered certain choices based on whether a particular practitioner has skin in the game. That's natural, and also I know that changing paradigms is rough, but we're in the middle of a shift. Perhaps I could have toned down the opening salvo a bit in that article, but I did want to attract attention, and the principles are still accurate. I stand by that article, though since then cone beam imaging has rocketed in popularity because they can show so much more. I want to make a point here. I didn't mention them in that 2012 article, but I wish I had. At the time, I knew cone beam scanners emitted 4 to 30 times more than conventional dental x-rays, and I just didn't think that that matched the philosophical priorities of Dr. Mercola's readers, nor did enough dentists have them at the time. That was my reasoning anyway. But that is the same thought fallacy that plagues us in dentistry anyway when it comes to informed consent. I was wrong not to mention them, because I wasn't giving them the full picture, and it really wasn't up to me to censor the information. Nonetheless, that article called "Are There Safer and Healthier Alternatives to Root Canals?" still proves more popular than anything else I've done for him, with over 1 million readers to date, and it is a reflection of how holistically inclined dentists and a large swath of the general public think about root canals, cavitations, and implants, as well as their relationship to general health. That doesn't mean patients won't opt for them necessarily. They'll examine their options and their priorities and come up with something that they think will work for them at that particular time in their lives. Our job is simply to give them informed consent as best we can and perform the procedures that they request, or refer them out if we're uncomfortable with them. That article took me about 4 months to put together, and because it's out there in the public domain and will be for some time, there's no reason for me to reinvent the wheel here. Just as it's proved a good tool for me in my practice when patients have endless questions about this subject, this article may help you as well. Our patients are usually shell-shocked and not in the greatest listening mode when they're in the office, and they need time to ponder all their choices. The polymer chain reaction tests run on the contents found within the sockets of extracted teeth and in cavitations pretty much shut down the whole conversation about whether there are whole body effects of these, or whether or not cavitations exist, or if root canals are always toxic. These PCR tests are what Dr. Huggins used to verify that his surgical intervention showed 99% of cavitations contained partial or totally unhealed bone. That about wraps it up for what I wanted to say about these controversial topics. I've attached an abbreviated clip from the video posted on Dr. Mercola's site with a rough cut or two so I wouldn't bore you with what you already know. In it, I summarized how many biological dentists approach root canals, cavitations, implants, and energy medicine, if you want to know any more on this topic. Thanks for hanging in there with me, and I'll see you next time.
Some use bleach, a laser, biocalyx, also known as endocal, or ozone in an attempt to sterilize the canal. Shrinkage of the material as it cools, underfilling or overfilling are just 3 ways root canals obviously fail. It is an oversimplification that pulp chambers are always straight, that there is always just one per root, and that cleaning or sealing the miles of tubules can be overlooked. Straight A to B thinking works no better than a straight line laser or a straight file. The thin, dark lining around each tooth is called the periodontal ligament. It is the shock absorber for each tooth during chewing. Unfortunately, chewing can pump oral microbes, and worse, their toxic wastes that remain within the tubules, the ligament, and the infected bone surrounding the dead tooth, into the blood vessels in the area and the mouth. From here, they can travel virtually anywhere in the body, like joints, organs, and the brain. Dr. Boyd Haley, Professor Emeritus of Chemistry at the University of Kentucky, discovered that root canal toxins in the parts per billion range inactivate critical enzymes that quarterback every activity of our bodies. They inactivate or impair hormones and neurological activity, while encouraging autoimmune issues. Haley is an expert on Alzheimer's disease and discovered that 2 important proteins are found in low concentrations in all those with Alzheimer's disease compared to those without it. Root canal teeth produce a waste product that annihilates these proteins 5 times faster than mercury does. A milder example, If you have mercury fillings, a root canal, and digestive problems, know that anaerobic bacteria in root canal teeth create poisonous hydrogen sulfide and methyl mercaptan gases that, when combined with mercury and other heavy metals, destroy digestive enzyme activity, eventually leading to a wide range of gastrointestinal problems. Some call root canal teeth more toxic than the botulinum toxin. In fact, unless a dentist uses ozone gas, he or she cannot sterilize a tooth with its miles of tubules. And because the perimeter of a tooth cannot be sealed, even with ozone, it is uncertain how long these tubules, or the bony socket anchoring it, stay sterile in a living environment. Most biological dentists suggest a range of 1 month to maybe a year. Sometimes the body tries to quarantine an infected tooth by forming a highly calcified bony wall around a root canal tooth that makes it look as though it is healing, when in fact the opposite is true. This is called condensing osteitis, and it looks super white on an X-ray. It can easily mask abscesses. A dense bony wall encasing a brittle dehydrated tooth makes properly extracting root canal teeth an enormous yet critical challenge if one is trying to regain health and has decided to remove all root canal teeth. Improperly done, they lead to equally poisonous jawbone cavitations like this one. Cavitations, which is slang for osteonecrosis, are areas of somewhat liquefied dead jawbone colonized by anaerobic bacteria and their waste products. Trauma, smoking, and diabetes can contribute to their formation, but improper extractions and clotting abnormalities are the biggest reason they form. Their toxicity is on a par with root canals, so it makes sense to also clean up jawbone cavitations when removing root canal teeth. Is it odd that cavitations, often resulting from dental procedures, are not recognized by traditional dentistry? Think about it. As a profession, we do better when we can point a finger to jawbone death arising from pharmaceutical drugs, like bisphosphonates, which are prescribed for osteoporosis or bone cancer, rather than pointing to our own profession. Testing a young oral surgeon, highly respected in traditional dental circles for his skill and brilliance, I recently queried him about them. He rolled his eyes and scoffed. Of course, cavitations exist. To help avoid cavitations after an extraction, a dentist must follow through as though he were finishing a cavitation surgery. He or she must thoroughly remove the ligament that surrounds the tooth. Additionally, at least 1 millimeter of bone should be carefully removed with a slow-speed drill and copious water spray. If there is condensing osteitis, as with this tooth, it too must be carefully removed. There are numerous additional adjuncts biological dentists use, such as irrigating the socket with an ozonated 5% concentration of magnesium chloride, ozone gassing the socket, and then filling with a biocompatible socket putty to control clotting problems. Many biological dentists will offer vitamin C, IV, and acupuncture or acupressure following the procedure to help clear meridians. Immune system support is always recommended. And of course it works both ways. Getting rid of root canals, cavitations, and heavy metals surely lightens the immune system's load and is a good way to start a person's journey back to health. Perhaps you have decided you must extract your root canal treated teeth to maintain or regain health, against the clear position stated by the American Association of Endodontists. You chose a biological dentist who can help you avoid cavitations and who boosted your immune system. Many people choose implants to replace a missing tooth. Implants are essentially an artificial root screwed into your jawbone topped with an artificial tooth or used as an anchor for a bridge or partial denture. Implants are displacing root canals because they look, feel, and function very much like a natural tooth and do not interfere with normal oral activities. They help maintain bone that normally dissolves over time after a tooth is extracted. They can last a long time and do not require grinding down adjacent teeth as a fixed bridge would require. But you must remember success is not measured only by tooth function, but function within your body as a whole. There are a number of important aspects of dental implants people should seriously consider before deciding to go forward with this major investment. Some people are concerned that implants contribute to cancers, cause galvanic currents, create oxidative stress, suppress the immune system's T cells, and slow energy flow along the body's meridians. If you have trouble thinking of this energy flow as acupuncture meridians, think of it as your body's fascial planes of interstitial connective tissue. There is merit to these concerns. Read more on Mercola.com, Safer and Healthier Alternatives to Root Canals. In this article, I introduce dental material biocompatibility testing labs and labs that DNA test for microbes that inhabit root canals and cavitations. Energy medicine is the future. Once you realize that your nervous system, cardiovascular system, muscles, and even how nutrients and waste move into and out of cells are examples of electrical subsystems operating within a bioelectrical body, this starts to make sense. I introduced energy medicine when I talked about electrical discharges emanating from metal tooth restorations, and again when I discussed root canals, implants, and using negative ion generators to clean the air and improve the electrical field around our bodies. Earthing is popular because people are beginning to understand that microwaves, cell towers, cell phones, electric cars, electric smart meters, and Wi-Fi connections create energy fields around us that impair our body's ability to stay healthy or to heal. Low-level light therapy has been used by sports therapists and other clinicians for years. Called biostimulation, cold laser therapy, and more recently, biomodulation, brief treatments to damaged tissue can activate an enhanced healing response. Wounds need a threshold voltage to heal. Biomodulation helps tissues, including bone, to regenerate. Biomodulation reduces acute inflammation, alleviates chronic pain, enhances wound healing, and even makes skin look younger and more vibrant. These clearly have a place in every dental office.